Paul, before we get on and talk about vaccine, just wanted to get your take on some comments that the Health Minister Stephen Donnelly made yesterday. There's a lot written in the papers this morning about this. He warned that the state is at a tipping point and that the coronavirus pandemic is close to having us all locked down in the country again. Would you share his concerns?
I think it's always concerning in terms of, especially when you look at numbers, and we have to be very vigilant. But in terms of responding to that, I think we really need to look beyond lockdown. I think it's generally recognised that, lockdown is a very blunt instrument. It's very harsh in the country. It's paralysed the country actually economically, also in terms of healthcare provision, socially. So I think we need to move beyond that. I think we've learned more. We've had greater than 6 months experience with this virus. And I think we need to move beyond lockdown and move beyond this idea. There seems to be this default notion of responding by going to either local or full lockdown. And again, I think we need to be more targeted and go to a situation where, we obviously employ. It's very important in terms of personal responsibility, societal responsibility in terms of, complying with social distancing, hygiene and masks, but also supplement that with really good testing and tracing that, first of all, identifies outbreaks in those high-risk areas very early on, identify them before they become larger outbreaks and before they get into the community. So I think that is really the approach, and I think we really we need to move beyond this situation where by default we're going to go into lockdown.